I think it's really important to recognize the UNA team and Congressman McAdams' staff for their hard work to get all of the details of this session put together and scheduled. Additionally, here's what I know about UNA's mission and our work: that it really is best served with a robust, dedicated team that is intentional, hardworking, and committed to this work. Therefore, I'd truly be remiss if I didn't acknowledge the efforts of my entire team. These past several weeks have been rough on all of us, and every single member of Team UNA has shown up in a big way. And for that, I am also grateful. Also, from my home, I'd like to acknowledge the unceded lands of the Goshute, Shoshone, and Ute peoples and the continued existence and contributions of Indigenous people who have lived on and cared for this land for thousands of years. At the Utah Nonprofits Association, our team works to provide access to resources and training to implement best practices which support success in the sector. We engage in state and federal policy to assure that the nonprofit sector is adequately represented. We also provide cost-saving benefits so that the budgets of nonprofits are positively impacted by engaging with us. Our mission to unify, strengthen, and elevate nonprofits in Utah is powerful. And through all of that work and everything that we do, it really boils down to this: we are good people doing good work for good causes. As we get started today, I must say that I have had many conversations with nonprofits these past weeks, and they are concerned, hopeful, dedicated, and relentless. Their loyalty to their missions truly grounds me. And the purpose of today is to discuss the issues and concerns from our nonprofit community, which I know are heightened as a result of COVID-19 and the immediate and long-term ramifications for the health and safety of our communities. Many participants on the call have submitted questions in advance, and Brandy from UNA will be moderating and assisting as we go along. Now, I'd like to introduce our guest of honor. Serving the 4th Congressional District, Congressman McAdams has a long political career serving as a mayor and a Utah State Senator. Also, as an attorney, the Congressman worked to protect victims of financial fraud. In his current role, he serves on the House Financial Services Committee and the House Science, Space, and Technology Committee, and he lives in Salt Lake City, Utah. Welcome, Congressman McAdams. Thank you so much for the time that you're dedicating to talk with your constituents today. The time is now yours.
Well, thank you, and it's great to be with you. Thank you for having me and for this opportunity. And look, thank you for all that each and every one of you do in our community. I had a chance to glance through some of the list of attendees. People are here on this call, and it's great to see some familiar names and just to think about the important work that each and every one of you are doing in our queue. And I know that many of you over the last few weeks, I can only imagine how stressful it must be for some of you with the economic situation for you and your entities and your employees, and the important work that you're trying to do that doesn't stop because of a pandemic. And it still is there, and it's important for you to be able to carry on. And I know it's so difficult in these times. Let me just tell you a little bit, because everybody always asks, so I will say that I am doing well. Thank you for those of you who sent warm wishes when I was sick with the coronavirus, and it hit me pretty hard. I think I'm 3 weeks recovered now, so doing really well, but spent 8 days in the hospital. So I would just caution, let's take this seriously and do everything we can to avoid it, to do our part to slow the spread, do it for yourselves. And if not for yourselves, do it for your loved ones and family and neighbors and for our community. This is really falls on all of us to do our part to slow the spread. Let me give you a quick update on what Congress has done thus far. I want to make sure to save plenty of time to hear from you, because I know that while many of the things that we've done should benefit nonprofits along with our small businesses and for-profits, I know that there are certain cases where you've been left behind, or there are cracks that our nonprofits have fallen through. And I want to have a chance to hear from you where you're seeing frustration and where we can help, either in bureaucratically or with future legislation. So let me give you just a quick update on what Congress has done. As most of you probably know, Congress has just passed the 4th coronavirus response bill. We passed it last week, last Friday, which provided nearly $400 billion in economic support for SBA programs, including the Paycheck Protection Program, or PPP. And for maybe the first time, Congress made smaller nonprofits, those that are 501c3s, eligible for this SBA assistance when it established the PPP forgivable loan program under the CARES Act. The CARES Act created an above-the-line deduction for donations to charities for up to $300 for those individuals who don't normally itemize their deductions, hoping to restore some of the hit that nonprofits took with the tax reform a couple of years ago. And that provision really is intended to incentivize giving to our nonprofit sector. The CARES Act also established a Main Street lending facility to be stood up at the Federal Reserve to provide low interest rates, low interest loans for businesses, including nonprofits. And when the Fed initially rolled out the terms for that facility, it appeared that it was going to exclude nonprofits, which was not the intention of Congress. So I wrote a letter to them to change the terms of that facility to ensure that our larger nonprofits are eligible and that their interest rates remain low, because the work that you do is so important, and really no one else is going to do it. So I'm hopeful that the Fed will heed that feedback, and we're expecting them to broaden the eligibility to ensure that nonprofits can participate in that as well. So what the 4th bill did, the one that we voted last week, it provided more money for the PPP and hospitals. And the first 3 bills focused on ensuring free testing, making sure that hospitals have personal protective equipment, expanding unemployment insurance availability, and providing an initial round of economic support for small and medium-sized businesses, including many nonprofits, and helping our state and localities with the resources that they need to fight the coronavirus on the ground. But I know that that work is not done. We have more work to do in DC legislatively, as well as the road ahead for each and every one of you is a long one, and we've got more work to do. I also know that our legislation hasn't been perfect. Part of that is the art of compromise and getting something that we can get done. And it's also recognizing that this pandemic required a rapid response. And so the legislation certainly isn't perfect. I'm going to continue to work to ensure that Utah businesses, our nonprofits, and families have the help that they need to weather this virus and to come out on the other side. So one of the unintended consequences of the CARES Act came to light this week as the Department of Labor issued some guidance that may treat nonprofits especially hard as it comes to reimbursing unemployment insurance costs. You may have seen an article on that recently. So me and my staff are looking into this point to better understand the guidance and what the solution may be moving forward, but we'd welcome your feedback on this point as well. I'm sure that some of you have gone through the process of applying for PPP loans, and some of you may have been successful, but I'm sure many of you have not. And we've been hearing from a lot of our businesses and nonprofits about how frustrating that process has been. So over the past few days, the phones in my office have been ringing off the hook, and I'm alarmed by the stories that I'm hearing from Utah small businesses and eligible nonprofits who just aren't able to access the PPP loans that were created to help them stay afloat. Small business owners are desperately seeking answers about why their loan applications are frozen, while companies like AutoNation and sports franchises like the LA Lakers, or we've heard of Shake Shack and others, have received millions in taxpayer-funded loans. These are hardworking people that we just spent $3 trillion of their tax money to fund this economic recovery, including programs like this. And it's really frustrating to me that they keep getting bumped to the back of the line. So we are working on that right now. It's just not right. And it isn't fair to the thousands of hardworking businesses, nonprofits, and their employees who just want to support their families, keep a paycheck, and keep doing the important work that they do. So yesterday, you may have seen, I called on the Treasury and the SBA to release a list of businesses who are benefiting from these programs. And I think taxpayers and Congress deserves to know and will help us to know if this program is benefiting the people who we intended to help. And as I've seen it right now, that there are loans being made to those people who we intended, but we're also seeing a lot of dollars being scooped up by entities who have other recourses. They have other places to go to look for that lifeline. And many of our small businesses and nonprofits have nowhere else to turn. And that's what this funding was intended for. So I'm going to continue to push the SBA and Treasury to treat our small business owners and our nonprofits fairly. That the government should be reaching out a hand to help those small businesses in need, not some of these multinational corporations, well-connected, well-heeled, that really don't need the help. I'm sure they all want to take the money, but they have other places they can look for a lifeline. They're not in the same jeopardy that a lot of our small businesses and nonprofits are. And that's why I think the economic measures that Congress has passed are so vital to many of our Utah businesses and nonprofits. These programs are helping to keep the floor in the economy. You know, we kind of sometimes slip into the verbiage of calling this stimulus. To be frank, there is not right now an economy to stimulate. It is a lifeline. It is relief. It is helping people to get through this crisis. And then when we come out the other side, we will look at what we can stimulate. But right now, it is just a lifeline to keep people going until we get through this crisis. So we've passed, as I said, 4 bills so far, and work is already underway on what the next bill might look like. So I'd love for you to stay in touch with my office and on the challenges that you're facing, as I mentioned, on the ground, how legislation may have some unintended consequences or gaps that we may not have foreseen, and let us know how we can be helpful. Look, as we start looking forward to safely reopening our economy, I know that our employees and our nonprofits and our businesses need to have confidence in our nation's and our state's coronavirus response. The government could declare today that we're going to go back to normal and everything should operate business as usual. But if the people and the employees and the businesses don't have a confidence in our response, then it's not going to make a huge difference. So we've got to instill confidence so our employees can feel comfortable going back to work, our businesses are comfortable opening their doors, and people are comfortable walking in your doors or receiving services from you or walking in the doors of our restaurants and our small businesses. So we have to have a plan to keep the spread of the infection in check, and also make sure people feel comfortable that our healthcare system won't be overwhelmed. Look, sadly, I think the coronavirus will be part of our communities until there's a vaccine, which experts say is probably 18 months away. I keep seeing headlines about testing and trials maybe bringing it sooner than that. That would be great. But a vaccine could be as far as 18 months away. And we may have some effective drug treatments. We're also seeing some headlines and news about effective forms of treatment that may help reduce the mortality rate or the severeness of the sickness. And that can only help also to inspire confidence from the public and help us get back to a sense of normality sooner rather than later. But for now, we have to continue with what's working. And that is social distancing, safer workplace conditions for those that are not able to work remotely, hygiene, washing our hands, using disinfectant, hand sanitizer, disinfecting surfaces, and especially protecting those who are the most vulnerable. So Utahns, I think we have that rugged Western spirit. We rise above challenges, and this time is no different. Recovery is going to happen as we move forward. It'll happen if we work together, everybody doing our part to slow the spread of this virus and get back on our feet and to protect each other's health and well-being and to restore economic opportunity. So, you know, just as I was as sick as I've ever been and I came through it and I'm much better today, I know that the same will happen for Utah and for our community. We're going to get through this. There's going to be a lot of hardship. There has been and there will be hardship along the way, but we can get through this. And you know, I hope to be in a position that we continue to extend a lifeline to each and every one of you so that as we do come through this, you are well poised to continue and get back to doing at full force the work, the important work that we need you to do. So thank you. I think we have plenty of time for some question and answer.
Thank you
Thank you.
so much. That we just appreciate all that you're doing, and I have been watching the chat and people just being so grateful for you being an advocate for our sector and all the work that we're working on here in Utah. I would like to turn the time over to Laura Thomas with the English Skills Learning Center. She has a question for you. Laura?
Great.
Good morning, Congressman, and everybody else. Thank you for your time. As part of my work, I work very closely with the refugee and immigrant population in Salt Lake City. So my question to you is, this pandemic has brought into even greater relief the healthcare inequity in our current system. Those that are the most vulnerable are often those that can't afford health insurance or major medical bills or don't have access to health insurance through their employer. What changes would you hope Congress would make to our healthcare system after what we've experienced through this health and economic crisis?
Well, thank you. And maybe there are two parts to answer that question. The first is, you're right, that this pandemic has highlighted the severe inequities in our system generally. That those who are most vulnerable, they are in many cases the essential workers who are most likely to be exposed, least likely to have health care and insurance, least likely to have savings that they can isolate and stay at home, least likely to have things like paid medical leave. And so they're feeling the impacts the hardest of anybody. So there's one question about the inequities in our society and how this has exposed those. And that is a long-term, it's taken us a long time to get to where we are, and the solutions are now evident, and we need to work on those. In the immediate term, as it relates to the coronavirus, I want to tell you a few things that that Congress did. Now, look, when our immediate response was, the first thing we have to do is to slow and try to stop the spread of the virus. And if you're going to stop the spread of the virus, you need a few things. You need testing. You don't want any individual to fail to get a test because they can't afford the test. So it's not only the right thing to do for the individual, it's the right thing to do for society, is to have no barriers to testing. So in the first legislation we passed, we said, we provided that testing will be free for anybody who needs it. So if you have insurance, I think that insurance picks it up, but you don't have a copay. If you don't have insurance, the test is available, no fee. And again, not only important for the individual, but clearly very important for society. The other thing that we want to make sure that people can do is, if they are feeling sick, or if they received a test and have tested positive, we need them to stay home, to isolate. And if you are living paycheck to paycheck, working for an hourly wage, and you can't afford really to miss work. The first few days that I was sick, so I got sick on a Saturday night. And it was actually very early. I think it was that week that the NBA had been canceled. And on Friday of that week, the schools announced that they were closing. Governor announced that statewide we were closing the schools. So that was Friday, March 13th. I first developed symptoms on Saturday night, March 14th. My symptoms were actually pretty mild on that first day. I felt achy. I had an elevated temperature, but doctor said it doesn't even count as a fever. My temperature was between 99 and 100 degrees, which is elevated, above normal, but they said my symptoms didn't justify a test. But they asked me to self-isolate and stay at home and monitor my systems. But my doctor said, I don't know if it's coronavirus. There could be a dozen different things. Just stay home. And so, look, I have a job where I work very hard and I work long hours, but I can do it from home, as we're doing right now. And so I followed that guidance and stayed home and isolated. I first came down with it on a Sunday, but on a Saturday, as I said, we had plans to go out, and I stayed home. My wife went out with friends, and I stayed home. And on Sunday, we stayed home, and then Monday was a work day, and I just took all of my meetings virtually, and it was really kind of no big deal. But I have to think, if I was working paycheck to paycheck, worried about paying rent or buying food, and I really didn't feel too bad, I probably would have gone to work. And I can see in a similar situation others going to work. So it was important for Congress to ensure that people had paid sick leave. And so that's one of the things we did in that first bill as well, is to require employers to provide sick leave to their employees, 2 weeks if related to the coronavirus. Can be longer under certain circumstances. If you have questions about that, let us know. But and that's something, by the way, I don't think it exempted nonprofits, so something that you are expected to provide to your employees. But what we did to soften the impact to small businesses is it can be 100% reimbursed as refundable tax credits. So you would need to pay that until you file your quarterly taxes. But when you file your quarterly taxes, you can get all of that money back that you paid to an employee for sick leave. And we felt that was important to give people the luxury of being able to stay home and continue to collect income. So those are two things that were very important to help those who are most vulnerable have the luxury. I do think it's a luxury and a privilege to have a life circumstances that we can follow the guidelines of our public health officials. And so we want them to do that in the short term. And I think we've cleared the barriers so that they're able to do that. Now it's a process of educating, letting them know, both them and their employers know what expectations and what opportunities are available for them. And then, as I said, for the long term, the inequities in our society that have been laid bare as a result of this pandemic, that is something we do need to continue to work on. And it's going to take, it took us a long time to get here, and we need to work over the long term to start to fix those inequities. But I think it is access to childcare, access to healthcare, access to unemployment, a livable wage. All of those things are important if we're going to remediate those inequities.
Thank you.
Thank you. And we have Emmy Gardner on the line from Holy Cross Ministries. She has a question for you.
Hi, Congressman. So great to see you again. And thank you, as always, for your advocacy and your desire for inclusivity for all Utahns. I just also wondered, as Congress continues to kind of look at the CARES Act, is it possible to encourage states to use some of their discretionary funds so that they could assist mixed status and undocumented families who we all know work very hard and pay taxes, yet under the current guidelines of the CARES Act are not eligible for many of the benefits that other citizens are?
Yeah, I think that's a great question. We are hearing from a lot of families, even from the economic stability payments, who are in mixed status families, that they are being hit really hard by that. Utah has always been a welcoming place, and I know that no place is perfect, and we've made our mistakes and we have our challenges, but I think we can also be proud of the fact that Utah has done okay as being a welcoming place for our immigrant community, our new Americans. And I've held virtual roundtables with some leaders in the community to discuss the coronavirus and the impact on our vulnerable communities. And you're correct that the CARES Act benefits were largely directed to U.S. citizens. And in terms of the economic impact payment, specifically was not available for mixed status families. It's hard to say how the state will use its money provided in the CARES Act. One of the things that I've been pushing for is for states and localities. And in our case, it's right now as it stands under the CARES Act, some of us are trying to change this, but local governments also receive funds in an amount if their population is greater than 500,000. So in Utah, the only local governments who qualify for that pass-through money is Salt Lake County and Utah County. And I actually would encourage you to have conversations with them as well. I was with Mayor Wilson yesterday, and she is very aware of the impacts on our vulnerable communities. We had a conversation about it, and she's very aware. So I'd encourage you to continue conversations with her. So I know that Treasury has developed some initial guidance, but I also know that more may be coming on allowable expenditures for those state dollars and those local dollars. And we've argued that the guidance should be as broad as possible since each state has unique needs that it needs to meet. So I think that is something that could happen. What I need to do from the congressional level is, again, ensure those funds can be used broadly. And please, I'm having these conversations, but I'd also encourage you to have conversations with our state and local governments to advocate for the use of those funds. That we know, as you know, going back to the last question, the communities that are most vulnerable and getting hit the hardest by this are the ones who it seems like are getting some of the fewest resources.
Thank you, Congressman.
Thank you, Emmy. Good to see you.
Thank you. I am going to ask this question for one of our nonprofits they've asked me to represent. Kids are going crazy being cooped up at home. Parents are also going crazy. Summer camps with kids at this organization is the busiest time of year, and this is happening with a lot of our nonprofits right now. It's looking more and more like the old model of running any kind of camp or class will need to change dramatically for social distancing. We need to make a decision very soon about our summer camps. As a parent, what do you envision your kids attending this summer? Are you comfortable having your child attending a camp with 8 to 12 other kids present at a site where every attempt is made to keep kids and staff safe? Or would you rather have your kids do a variety of online classes at home?
Well, thank you. Let me first say, as a parent of 4 kids, we have 14-year-old twins, an 11-year-old, and a 9-year-old. And I can just underline and emphasize the intro to that question, that kids are going crazy, and parents as well. And it almost felt the wheels coming off the homeschooling bus this week, as we were trying to keep our kids entertained and focused. And so it has been a challenge. And you know, so our kids do a lot of things during the summer. They are really looking forward to summer. One of our family traditions, we do political, 4th of July parades. I think we do 15 to 20 parades every summer. And it looks like the Days of 47 has been canceled. I don't know what will happen with other parades. I assume that we may see some of those canceled. I'm disappointed. I actually don't know that my kid's probably okay with the parades being canceled. Our kids do camps, a lot of different camps, and this is the time of year that we are looking at arranging those camps. What are they signing up for? Our kids also play sports and are anxious to get back to playing baseball. And the baseball coach sent out a similar memo, this email this week saying, are you comfortable having your kids play if they're social distanced? Are you not comfortable? And the breakdown was kind of 50-50. So our family may be a bit of an outlier because I've had it, and we're anxious for an antibody test because we suspect that the rest of the family was definitely exposed. Don't know if they got it or not, but we may have a little bit of immunity here, and our kids are going stir crazy and anxious to get out. But I would think that probably a mixture. Talking to parents that that our kids are friends with, it's people are still have some fear and anxiety about it. I think we're going to want to follow the data and the recommendations from our public health officials and from our governor, but I think we would probably be comfortable if it's consistent with recommendations from the state. I think we'd probably be comfortable participating as long as the summer program provider is following all the guidelines. I think doing it from home is also something we may be interested in. I know that it is hard. The homeschooling is hard. Our kids are tired of it. It's hard for us to continue to be a teacher, right? I've got my son helping with social media stuff. I don't know if I'll ever post it, but it was a good way to keep him entertained and active, editing videos and stuff for me. So we're trying to come up with creative ways to keep them interested and engaged. But I don't know if that answers the question. I answer more as a parent, but I would love to see what Bad Dog Arts is doing, and we may look to sign up and join those programs. So thank you.
Thank you so much. We have Stacy Allen with the Cystic Fibrosis Foundation. She has a question for you. Stacy?
Hi, thank you so much. It's so nice of you to take the time, Representative McAdams, and it's good to see you here and healthy. I am representing the Cystic Fibrosis Foundation. My husband and I live with our 2 kids in Harriman, one of which has cystic fibrosis. Evan, he's 6. For those on the call that aren't familiar with the disease, just as a quick background, cystic fibrosis is a life-threatening genetic disease that causes persistent lung infections and leads to the rapid decline of the ability to breathe and eventually respiratory failure, which I'm sure it's a little bit of a new home for you. While there's no evidence to suggest that those with CF are more likely to catch COVID-19, there is evidence to suggest that once infected, those with underlying conditions such as CF are more likely to develop a serious illness because of it. So I know that the COVID-19 pandemic is unsettling for all of us, but especially those with special healthcare needs. It's magnifying the financial burden that comes and the stress that comes with maintaining the level of care needed for those with CF. For all too many of our families in our community, that means making the decision between going to work and risk getting exposed or staying home and losing a paycheck, which really is not an option to maintain the level of care that's needed. Kind of as you touched on with the first question, I know that only people with child care needs are eligible for the Paid Family and Medical Leave Act under the expanded emergency use of the Family and Medical Leave Act, like you were touching on. I personally feel like this policy leaves out so many families, ours included, that make the sacrifices needed to stay home, as childcare sometimes is not an option to risk exposure when things are good, let alone during a pandemic. So I guess my question and my ask is, as Congress develops its next legislative response to COVID-19, it's critical, and I would ask that you help to ensure that people with underlying conditions such as CF and working members of their household receive the job protection that's needed and the financial support that enables them to stay home during the duration of the pandemic, so that we can protect the most vulnerable, my child, for example, without the fear of losing a job, or perhaps more importantly, the related benefits that come with that job.
Thank you. Again, that's an immediate need and a long-term need, a challenge. So thank you. Pay attention to that.
Sorry, trying to find my mute button. Thank you so much. I have a list of questions from our members that I'm going to go ahead and run through if you're okay with that.
Yeah.
Okay. On Monday, the U.S. Labor Department issued guidance on unemployment insurance. Despite the language in the CARES Act saying the federal government will cover half of the benefit costs of self-insured nonprofits, the Department of Labor is saying the nonprofits must pay 100% of the benefits received by their laid off or furloughed employees. Now and later, get a check for half. Congress is trying to put money into nonprofits, and the Labor Department is trying to take it away. Can you assure us that what the Labor Department is, or please assure me that what the Labor Department isn't your intent in the CARES Act, and that you'll work to ensure nonprofits are held harmless for layoffs caused by COVID-19?
Well, thank you. And I can assure you that that is not the intent. That is not, at least my understanding of the intent. And I'm really glad that you raised this. This wasn't the issue that I mentioned earlier during my opening remarks. We are still examining this to find out what we can do. And I'm not sure if the Department of Labor can solve it through revised guidance, or it may take a congressional fix. If they're not willing to solve it, it may take a congressional fix. But that's an issue that not only myself, but I've talked with a number of my House colleagues are also discussing. I expect it to be part of a discussion in the next legislative package. Know that everybody's been hit hard by this pandemic, but I know that many of our nonprofits have been hit especially hard because you rely on donations from people who just aren't able to donate right now. And so it is kind of a double whammy if we come back and expect you to pay the cost of unemployment insurance. And it's one thing to just have to carry it, but then to only be reimbursed for half of it is really a hardship on many of our nonprofits, and I'm sure will have a devastating effect on so many. Thank you.
Thank you so much. I have Christy Chambers with the Columbus Community Center. She has a question for you. Christy?
Good morning, Congressman McAdams. Really nice to see you back and recovered. We were really worried there for a few minutes, but happy to see that you're doing your good work. We were very fortunate to receive the PPP in the first round, and it was a lifeline, as you had mentioned, saved us from furloughing as many as 20 to 30 employees, and really came at the exact right time for us to be able to maintain our workforce and preserve our infrastructure. So thank you and Congress for the quick response. My question is more on the back end. I understand that we have 8 weeks to use that payroll to pay our staff. At the end of that, though, however, we're going to have to really evaluate the impact of this. And I know for a fact that our business will contract as a result of this and may not be able to expand for quite some time. We hope to fully recover, but that there's an uncertainty there. And I would suspect that this protracted virus and the consequences of it and how we as a nation are responding to it, the timeline is extended out. What is Congress's back-end response to, once those 8 weeks have expired, to preventing people from being unemployed as a result of businesses needing to respond to their economic needs?
Thank you, Christine. It's good to see you too. You and the Columbus Center have been on my mind, so it's good to see you. So, as I talked about some of the policy rationale for the different pieces of legislation that we passed, I talked about policy rationale for free testing, not only the right thing to do, but there's a societal policy justification for it and for the paid sick leave as well. The societal justification, the policy rationale for the PPP is really what we want when the economy dropped off a cliff so abruptly and due to the pandemic. The economy is not fundamentally broken. It is the pandemic that has caused the economic hardship. So if the point comes that we are able to ease the impact of slow the spread of the virus and lessen concerns about the pandemic, the hope is, now I think there will be some economic impacts that will take longer to fix, but the economy could spring back to life. But one of the best things to do to ensure that it can spring back to life is to make sure that all of those businesses are ready to flip on the light switch and unlock the door and go back to work. And the way to do that is to keep employees connected to their business, to keep those employees having a paycheck and that lifeline to support their families. And so that's what you saw with the PPP, is to maintain the social fabric of the economy. And so I think what we've invested so far certainly has put food on the table for a lot of people who need it. But if we get 8 weeks into it, and then those businesses fail and those employees are fired or laid off, furloughed, and that connection is severed, we really will have lost a lot of the benefit, the societal benefit for investing in the PPP program. So we are talking with many of my colleagues about if we are not in a situation where we're able to start seeing rejuvenation of the economy, that we may need to extend the timeline for the PPP, but that would take further congressional action. But it's helpful for me to hear those stories from you and from businesses and nonprofits similarly situated, so that I have real world Utah specific examples that I can cite as I talk to my colleagues about the need for that.
Very good. I'm happy to share those stories too as we get further into it. So thank you so much for your great work.
Thanks, Christy.
Thank you. We have Donna McAleer with the Bicycle Collective. She has a question for you.
Hello, Representative McAdams.
Hi, Donna. Good to see you.
Good to see you, and good to see you healthy. Thank you. First of all, thank you just for your empathy as a parent and as a person. I'd like to, some of these statistics you likely know, but I'd like you to share them with your colleagues in these legislative matters. As you know, the nonprofit sector in the US is the third largest sector of employment, larger than finance, larger than construction. In Utah, we represent nearly 7% of the workforce, employing 78,000 people. and our impact is in the hundreds of thousands, maybe even in the millions of those most vulnerable, the hungry, the homeless, those coming out of abuse, you name it, we support it. I'd like to know and learn if there's any opportunities for nonprofits who partner with each other as effectiveness multipliers of maybe some focus towards that. For example, the Bicycle Collective provides transportation, self-reliant transportation and mobility to people who don't otherwise have it. With the rest of the community, we've got 30 plus nonprofit partners in the state we work with. A lot of us work with each other and are resourceful and very frugal in how we allocate resources. I guess I'm kind of hopeful that there's some opportunities for organizations that work together to use some of these federal resources. You probably saw my op-ed in the paper on the 2nd of April. I was quite frustrated at Governor Herbert for not including nonprofits in the first round of bridge loan funding. He has subsequently done so after, but is there anything for nonprofits that work together to multiply their effectiveness?
I think that sounds like a really smart approach. Early on when we saw some of the guidance taking shape where the nonprofits were being left behind, I was hearing loud from so many nonprofits, and it had a real impact on me and mobilizing and our ability to mobilize and reach out to the businesses that the nonprofits that we were hearing from, reach out to the Treasury and the SBA and others to advocate for nonprofits. So, I think that is a really smart approach, and please continue to do so. I'd like to think that that I'm in your corner, but I still tell people to continue to reach out to me too. Just if nothing else, sometimes we're not aware of the impact or the urgency of it or the priority level. And so please reach out to me. It just helps us to be a better advocate and to reach out to your representatives and make that case. And early on, it was successful. Me and many of my colleagues heard from the nonprofits and were able to mobilize and to shape it in a better direction. Now, again, we still got work to do. There's some unintended consequences, but continue to do that. And I think that's smart to continue to do that as a unified force.
Thank you.
Thanks, Donna.
Thank you so much for everyone's time this morning. We are coming to the end of our time together, and we have quite a few other questions. I can follow up with your team, Representative, to get further information and direction on the additional questions we have. I know that we really appreciate your time this morning, and I'd like to open up the floor for Representative McAdams and Kate to have our closing remarks.
Well, thank you again. I just think I've said most of what I want to say, but I just want to express my gratitude as I think I interface with many of you so much more as mayor, and sometimes I still miss that job title where we're on the ground, working shoulder to shoulder, serving our vulnerable communities and advocating on so many issues that are important to our state and our region. And so I miss the day-by-day association with so many of you. But please consider me a friend and an ally in Washington. Let me know how we can advocate for you and where legislation or administrative regulation direction is going awry and how we can support you. So happy to see so many of you on this call. I can only imagine the hardships that you're facing day in and day out right now. We need you to be strong. We need you to come out the other side of this, because if you think your work's important now or last month, wait till 2 or 3 months from now. Your work is going to be really, really important, and we need you to be strong and to be healthy and solvent and able to move forward. So thank you for weathering this, and let's make it through together.
As nonprofit leaders, I think it's so great to hear the reinforcement of connecting with you and our other elected officials about the issues that are impacting our communities and our daily lives that we're existing in, and trying to I don't know, keep afloat, as it were. So I want to thank you for that, Congressman McAdams. But then I also want to make a call to all of the nonprofit leaders who are listening in on this session today. I think it's incredibly important that we continue to reach out to our elected officials, continue to share with them the impacts that COVID-19 has on our operations and the work that we're doing, but also so that they can understand what's going on and really have those stories, but also so that they make sure that, or that we know that they can reach out and share that story and really learn about what's going on within our communities. So continue to reach out to your elected officials, both at the local level and at the federal level, because I think that it's really critically important. And the Congressman has really driven that home for us today. And it's great to have an ally in this work, knowing that nonprofits are a critical economic driver to the success of our communities. So I'd like to thank you, Congressman, for your efforts in that, and also for all of you for spending this time with us today. Thank you, Brandy, for collecting all of those questions. Hopefully, though we haven't rehearsed this piece, hopefully, Brandy, you'll be able to see if we can get some maybe written answers to some of those other questions. Is that possible?
Yes,
Probably.
I have been chatting with Tiffany from the representatives team. I will be following up with Tiffany and another staff person with the questions, because I know we weren't able to get to them all today. And then I will be following up with everyone who has registered and who was on the call this morning to ensure that everyone has the information, as well as ways to reach out to the representative's office so that he can continue to have that connection and the storytelling piece that is so needed when working up on the Hill. So thank you.
Great. Thank you. All right. Well, enjoy, everybody. Enjoy the day, and hopefully all of your families are well and safe. Take care.
Thank you, Kate. Thank you.
Thank you.